Good evening, everyone. I am Ayana Harry, and thanks for joining me for a Pix 11 Facebook Live conversation. This week, we're taking an in-depth look at the dramatic health disparities along racial lines for expectant and new mothers here in New York City. We have a doctor who is based in Brooklyn that will be answering some of our questions live. And this investigation, this report, is part of our special Pix 11 series, Created Equal.
Black women in the U.S. die at 3 to 4 times the rate of white women from childbirth-related causes, one of the largest of all racial disparities in women's health, according to the CDC. That's a staggering divide.
They told us that they were going to take care of Amber. Amber was in good hands.
In April, Bruce McIntyre lost the love of his life, the mother of his child, Amber Rose Isaac.
One of the happiest years for us. It turned into a nightmare.
Researchers have been alarmed for years by the connection between racial bias in the healthcare system and Black women dying at higher rates before, during, and even up to a year after delivery. Amber, who was Black and Puerto Rican, faced an even deeper difficulty: pregnant during the pandemic.
That's when her platelet levels were dropping. But we weren't aware of that.
With hospitals overwhelmed, Amber could only see her doctor through virtual visits. In her final message on Twitter, Amber even complained about dealing with incompetent doctors at Montefiore Hospital in the Bronx.
She's voicing her concerns. Nobody's listening.
Today, her baby Elias is healthy. Amber died after complications from her C-section surgery. And Amber's story is not unique. According to New York City's health department, Black mothers in the city are 8 to 12 times more likely to die from childbirth-related causes than white mothers.
Really, the root cause is racism.
Even before the pandemic, the World Health Organization found Black pregnant women and new mothers in the U.S. die at the same rate as women in countries like Mexico and Uzbekistan. Several factors drive the high maternal mortality rates among Black women, from the bias of doctors and nurses to limited access to prenatal services. Dr. Christina Pardo runs the Health Equity Program of the OBGYN department at SUNY Downstate Hospital.
Why are certain communities more underserved?
In 2016, the New York City Health Department found women are most likely to face life-threatening complications during delivery in low-income communities of color: Brownsville, East Flatbush, East New York, and Bedford-Stuyvesant. In Bed-Stuy's Woodhull Hospital on July 2nd, Sha'Asia Washington went into cardiac arrest during labor. Sha'Asia died before meeting her baby girl, Chloe. Her family held a rally, heartbroken.
If she came in this hospital 10 minutes prior to her death, she was fine. We were on FaceTime.
The risks of maternal mortality impact Black women of all ages, education levels, and even incomes. Tennis megastar Serena Williams almost died after the birth of her daughter, Olympia. Williams said after feeling short of breath, she had to insist doctors perform a CT scan after nurses initially resisted. It turned out the tennis great had several blood clots in her lungs. Dr. Pardo says many Black women have similar experiences.
They're more likely not to be listened to. They feel like they're more likely to be discriminated against.
And the voice you just heard, that medical doctor, Dr. Christina Pardo, is here with us live. Again, the Director of Health Equity at SUNY Downstate's OBGYN department, and a longtime advocate for both women's health and healthcare in underserved communities, especially right here in New York City. Dr. Pardo, thank you so much for your time. Thank you for joining us.
For having me and talking about this important topic.
So, Dr. Pardo, at what point in your medical studies did you begin to recognize that there was a huge gap between the numbers of Black women and white women dying before and after childbirth?
So first, health disparities, the differences between outcomes between racial groups, this one specifically between Black and white, it is unfortunately not a new phenomenon. It's something that has been present for decades. And it's something that has been published for a long time. So this is not the first time that the information has come out. But I will say what I was positive about now is that this is a time where we are starting to discuss why we are seeing these health disparities, why contributing factors, that we didn't discuss previously, like bias and racism. So it's something that has always been known, but we are seeing a renewed focus and effort on it, especially because of the unacceptable numbers as it relates to maternal mortality.
One of the women that I spoke with as part of this report is a midwife. She's based in the Bronx, and she's hearing more and more from women saying, I want to explore a home birth as an option. Is a home birth for everyone? And what should expected moms consider in thinking about a home birth?
So there are definitely different levels of maternity care that are provided or that are options, including home birth. Home birth is something I think when you ask me is it for everybody, I would say overall no, because there are different women with different pregnancies and different complications, potential risk for complications. So it's very important that you engage with your maternal care provider, whether it be a midwife or an obstetrician, to discuss specifically where is our potential appropriate settings to have your particular delivery.
So if you do opt to have a delivery in a hospital, what would you advise women for how they can be advocates for themselves? Because so often throughout this piece, I heard from people saying, I spoke up or my partner spoke up. They knew something was wrong. They knew they were in trouble. They knew the pain that they were feeling, wasn't just quite right, but they kept saying they felt like people didn't believe them. So how can people be advocates for themselves?
What's I don't want to say what's great, but what's great about now in this focus is that you're hearing more and more women and families sharing these stories that we didn't share previously. So now that even groups, individuals like yourself and Pix 11 are talking about this problem, more women are saying, I felt like I wasn't being listened to. So first, I want all the women to know, all families to know that most healthcare providers, most institutions are people who are working hard, but may not be aware of a lot of things that are happening, may not be aware of the role of biases. And we are making a lot of effort now to address that. And you are our partners in that. So speaking up when you feel that you may not have been heard, asking for a second opinion, partnering with community organizations, with doulas, with support persons that can help you to navigate your prenatal care and your delivery, so that sometimes when you feel you didn't receive all the information, that support person can help you to understand perhaps the gaps, or to help you to advocate and navigate with your maternity care provider. And we need your input. So please make sure to let us know if there's something you do not understand or something that you felt wasn't addressed appropriately.
One more quick question for me before we get into the viewer comments. I know that these disparities, as you mentioned, existed long before COVID-19. Any preliminary thoughts on the impact of the pandemic on, Black and brown women's ability to get access to healthcare, and some of these disparities, for those expectant moms who were due and gave birth in March and April and May, when things were really, really locked down?
So COVID-19 really was just a live evidence of the way structural racism and inequity has affected our society. If people question the proof, that was the proof. And as many things were on pause, pregnancy and delivery is not something that can pause. So we did, as everybody was working hard to figure out how to provide care, the effect and the barriers for women who were pregnant were definitely had increased risk everywhere. But in systems where there were already barriers, you see the potential for it to be heightened. So for instance, in immigrant communities where there may be language barriers, it may be harder to navigate the system. Women who had to continue their prenatal care, had to come to hospitals for delivery, were afraid. So they were seeing a lot more women who were not having care during that time period because of their fear, and also maybe not understanding how to navigate the system during that time. So I think, now there's going to be a lot of study on the, and those are anecdotal observations, but there's going to be a lot of study into how this impacted all of our communities, but especially our pregnant population, because that is something that, as we know, those like emergencies, it's not something that we're able to pause and hopefully learn from.
Absolutely. So I want to go ahead and take a look at some of the comments from our viewers. We did post the full Created Equal segment on our website. And of course, so many of you weighed in with a lot of really thoughtful comments, and I appreciate that. One person said, I knew the stat. What is being done to improve this? And another person chimed in, something weird, said, why? Negligence, malpractice, bad health history. We need more comprehensive reasons for this to prevent in the future. And so, Dr. Pardo, why? Do we know why?
So for the first to know why, that is part of the comprehensive proposals and properly addressing it. So we realized when the statistics came out on the Black-white disparity that we need to delve deeper and understand why this is happening, studying outcomes and pregnancy complications by race, by ethnicity. And so, for instance, here in New York, there is the Maternal Mortality Review, where they go through these cases and look at social factors, look at racial factors, understand did potential bias and racism play a part. And unfortunately, before we had this focus on maternal health disparities, we were not taking that deep dive. So that is part of the work that we are doing. But we know racism is a root cause. And when I say racism, that can be racism between one-on-one, but it also means racism in the system, where you live. Yes.
Absolutely. So one more comment that I want to dive into really quickly. Jasmine Beltran said, interesting, but is it because of racial injustice and inequality, or because of genes/state of health? And that's kind of what you're saying researchers are looking into now?
Yes. And so first I want to address the gene part. So, there's not a genetic proof that says there are differences between races. So for a long time, they said there are differences, and that's why there is not a genetic reason for a difference. So the difference comes from outside of that, which can include racism and bias, which can include what we call our social environment, what type of education, what type of access to nutrition, transportation do we have access to, what type of hospitals and health systems are the hospitals in our communities, do they have the same things that affluent communities have, and how does that play a part? So that what we call racism plays a level on all in unfortunately multiple levels, and we know that to be the root cause, and now we are digging deeper to look for more specifics so we can develop programs to address properly.
One more comment that we're gonna get in. Maria Guerra says, I was a maternity nurse. Besides other nursing duties, always treated my mommy-to-be's with dignity and respect, always going out of my way to help no matter what race, loved it. And I think that that's the goal, right? Is for healthcare providers to treat everyone equally and fairly. And hopefully the research that you're talking to us about will help shine a light so that we can get to a day where these disparities don't exist.
Yes, and what I appreciate about that comment is also shows that just like many of us who are in service fields, most are there to help, to treat. They love, especially labor and delivery nurses, physicians, obstetricians, those in training. They truly do love their skill and their craft. And that's why we call things what we say implicit biases. So at times, as on individual levels, we may have things in our mind that we do not realize affect the care that we are having, or how we may hear or interpret things. That's why we now have training on that. And also, traditionally, we weren't taught about how our social environment, how the things outside of the hospital affect our patients. And how we can better take care of them. So there's which is why, we focus to integrate that. So, many things are not on any one individual practitioner. At times, as a whole that may be there, but we are working on filling the gaps of what we did not know as a practice affected our patients and have made commitments to integrating and addressing that.
Dr. Pardo, thank you so much. I know you are a very, very busy woman, so I truly appreciate your time. Also, you have a public Facebook page if anyone would like to go and learn more about you, get some information. And is there any social media connected to the hospital that you'd like to share as well?
Sure. So we, I've Dr. Christina Pardo is my public Facebook page, and we also have for our department a Downstate Community Women's Health Facebook page, and that is our interface where we share information. We have virtual programs, our connection to our community organizations. And I want to make sure I thank all the community-based organizations that we partner with, that we learn from, that help us to navigate the work that we're doing. So we'll share information on that work, and obviously, hope to hear from everybody out there and how we can continue to move this forward.
Absolutely incredible work that is so needed. And so I thank you and I salute you. And for all the viewers at home, if you'd like to take a look again at the full piece, you can find it online at pix11.com/createdequal. Again, I am Ayana Harry. Thank you for joining us and have a terrific evening.